My name is Tiffany Henry, and I'm going to be demonstrating an IV bolus as well as a large volume IV medication. So I'm in the med room. I have performed hand hygiene. I have compared my MAR to my doctor's orders and done my first med check. I'm now going to don gloves and I'm going to go to the Pyxis. And I'm going to pull my medications. And I'm going to now do my second med check. So I have 0.9 normal saline IV. I have my 0.9 sodium chloride normal saline. It is 250 milligrams, which is 250 milligrams, so everything matches here. I am checking the bag for patency to make sure there's no leaks. I'm looking to make sure that there are no particles, the fluid is clear, and the expiration date is good. So now I have my 20 milliequivalents of potassium chloride that is going to be infused into my normal saline. So I have my 20 milliequivalents of potassium chloride, and it is a concentrate, so I've already done the dimensional analysis, and I'm going to pull 10 mils of this, and the expiration date is also good on this. And then I have my morphine sulfate, which is 4 milligrams, and I have morphine sulfate, which is 1 mil every 10 milligrams. I have already done my dimensional analysis on this, and I'm going to pull 0.4 mils, and I'm going to reconstitute with 1 mil of normal saline. And the expiration date is good on this as well. So I'm going to start with my potassium chloride. I'm going to get my 10 mil syringe. And I'm going to get my draw needle. And I am going to clean the top. And I'm going to do this for 10 seconds, but for video purposes. I'm going to draw back and get 10 mils of air. Get my air bubbles out. And I'm going to make sure I'm right at 10 mils. And I'm going to recap that for just a moment, and then I'm going to get my 0.9 normal saline, and I'm going to clean the port for 10 seconds. And I'm going to now inject my potassium chloride. And this is going into the Sharps container. I'm now going to invert the bag, making sure not to shake it. And then I am going to label my bag on the back so as not to cover anything up from the front. And I've got my potassium chloride, as well as my patient sticker. Okay, so I'm going to set this aside because I got to take that in the room with me to scan it. So I'm now going to, actually I'm going to clean the top of my morphine, again for 10 seconds. And I'm going to get my 3 ml syringe. And I'm going to get my morphine needle. And I'm going to pull back 0.4 for air, and I'm going to inject that in, and then I'm going to withdraw my 0.4. And I'm going to get my air bubbles out. Sure, 1. And I have my 4. Double checking with a second nurse.
Yep. I'm the second nurse, and it's right.
Verified? Okay. I'm now going to reconstitute with 1 ml. Making sure to get this carefully because I cannot push any back out or I will be wasting morphine and the patient will not get the correct dosage. And then I'm going to take off my needle. That goes into sharps. And I'm going to recap this with a little blue cap because it's better to go into the patient's room this way since we're going to do the IV bolus so she doesn't think she's getting a shot giving her anxiety. And then I will label my medication with the morphine and with also the reconstitution amount. And I will have that to take into the patient's room. I will also take this with me because I have to scan this as well. So, now that I have everything, I'm going to take my gloves off. I'm going to perform hand hygiene. I am going to get my face shield. And I'm going to enter the patient's room. Knocking on the door, providing privacy for my patient. Hi Shirley, how are you today? Good. So her pain level is a 9 out of 10. So I've let her know that the doctor has ordered her PRN for the morphine. And Shirley, can you tell me your name and date of birth? Shirley Cost, 4/3/87. That matches both my provider's orders as well as my MAR. And she does say she is allergic to codeine, which is on her band, and also matches my MAR. So I've explained to Shirley, I've asked her if she has any questions. She says no. I am assessing her site real fast to make sure everything looks good. And I am now going to clean the site. And again, I'm going to do this for 10 to 15 seconds. And I'm going to get my 3 mils of normal saline, and we're going to flush. And before I do that, I'm actually going to aspirate back just a little bit. I get a flash of blood, and then I'm going to push, making sure that it is patent. I'm going to clean the site again. Ten, 15 seconds. And then when I'm pushing the morphine, I want to do this slowly for approximately 2 minutes. For video purposes, we're going to push. This is going to go into my sharps container because it has morphine in it, or had morphine in it. I'm going to do another wipe. And then I'm going to do another saline push to make sure all the medication is in the patient. So now I'm going to go ahead and get my bag of normal saline. With my chloride, I am going to get my tubing. And I want to hold both ends. Making sure this end does not ever touch the floor. Take off the top and spike the bag. And I'm going to hang the bag. And I want to make sure that I prime. So it's about half full. And then I'm going to open the chamber, and we're going to let it fill up. And once we're full, we're going to turn Minnesota upside down. I'm going to take this top off right here. And we're going to prime to get all the air bubbles out. All the air bubbles are out. put this in here. Maybe the back is closed. I'm going to get another wipe. And I'm going to clean our board again. And I'm going to attach. I'm going to go ahead and now I'm going to set my pump. I look for my 0.9 normal saline. And I'm going to set it for 125 mils an hour for 2 hours. So, Shirley, do you have any questions? No? Okay, perfect. So I'm going to do hand hygiene. Take my gloves off, do hand hygiene. I'm now going to go find a second nurse because I have to discard this morphine and I need a second nurse to verify that, and we will do that in the med room. So, discarded that. I am coming back now 2 hours later. Hi Shirley, how are you? Good. So now I want to assess Shirley's site. There's no infiltration and there is no phlebitis. Shirley's medication has run out, so I'm going to stop the machine. And actually, before I disconnect, I'm going to get my little blue tube. And I would have labeled my tubing, the date and time that I did it. So I'm going to and I'm going to cap this to keep it sterile. I'm going to hang it here, making sure that it stays above this. And I'm going to clean again. And I'm going to flush again, making sure, again, all the medication is in the patient. I am then going to perform hand hygiene, take my gloves off, perform hand hygiene. Ask Shirley if she has any questions. She doesn't. And I am now going to go and I'm going to document start time, stop time, my name, my initials. I'm going to document medications given, how much was given, that it was via bolus, also via IV. I am going to document patient's toleration. I am going to document that there was no phlebitis, no infiltration, and that's it.